Okay, so hello and welcome to Itentive Healthcare Solutions webinar. We're excited to share our next-gen add-on solution, ChartGuard, with you today. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Itentive. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that the webinar will be recorded. Next, for those of you who aren't familiar with Itentive, I want to share a bit of who we are with you. We have specialized specifically in next-gen healthcare. Our goal in life is to make delighted clients by helping them get the absolute most out of their next-gen software investment. We're passionate about providing solutions for our healthcare providers partners, which in turn help them to improve the patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything next-gen, and we have two add-on productivity solutions for next-gen, ChartGuard and Refund Manager. Next, I wanted to share some upcoming webinar with you. The next one's going to be on April 19th, and it's going to be on quality reporting using NextGen HQM. In it, we're going to do an overview of the NextGen Health Quality Measures web portal, go over how using the HQM for reporting under the Quality Payment Program established by MACRA, and we're also going to go over new features in the 5.0 upgrades, such as measure visual indicators, editability to search for white papers, and much more. I'll be sending out an email invitation for that later today, so we hope to see you there for that educational webinar. Okay, so back to ChartGuard. At the end of the presentation, we're going to open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. So without further delay, I'd like to introduce our presenters for today. Tom Seco is Itentive's Business Development Manager, and Joe Schultz is Director of Product Solutions at Itentive, which means that him and his team are the people that actually got to build this great program. Okay, so Tom, I'm going to go ahead and pass the webinar off to you. Please feel free to get started when you're ready.
All right, thank you very much, Chelsea. And I want to thank everyone for taking time out of their busy day today to learn about our ChartGuard product as well as downtime preparedness and business continuity solutions. Here's an agenda that we put together for today's webinar. What we'll do today is we'll talk about what ChartGuard is. We'll talk about EHR dependencies and why practices buy ChartGuard. We'll talk about how it works, and then we'll show you the output of ChartGuard that gets generated. And then I'll give you a brief overview of who Itentive is, and then as Chelsea mentioned, you'll be able to enter in your questions at the end of the presentation and we can provide answers to you. So what is ChartGuard? Well, ChartGuard is a business continuity solution that ensures the availability of patient charts during EHR downtime and addresses the downtime preparedness at each of the clinic locations or office locations. And why people buy ChartGuard is, why practices and health centers buy ChartGuard is, one reason is because of a HIPAA clause. There's a HIPAA clause that states that you need to establish and implement as needed policies and procedures for responding to an emergency or other occurrence that damages systems that contain electronic protected health information. With a business continuity solution such as ChartGuard, you pretty much can address the third bullet, emergency mode operation plan, meaning that you have a solution in place that when you lose access to your system and lose access to your EHR, you're able to continue to see your patients using the current patient chart information when they come into the office. Another reason people buy ChartGuard and business continuity solutions like ChartGuard is because we have become so dependent in life on technology, and this is transferred over to EHR systems that we've purchased over the past several years. The technology behind all of this is very complex, meaning that we have many, many components that make up the technology and run the technology. So we have servers, we have workstations, we have tablets, we have scanners, we have local area networks, we have wireless routers, we have VPNs, we have T1 lines, we have internet connections, we have power systems, cooling systems, and behind all of that we also have software that runs each one of these components. So if one of these components goes down or we lose access to one of these components, we lose access to our EHR systems and our EPM systems. So when we lose access to this, what does that mean to us as a practice or a health center? Well, when we lose it, it means we can have an impact of quality of care. It means that we could have lost productivity. It means we could have lost revenue. It means that we could have, some type of embarrassment, meaning, we're sitting in front of a patient and all of a sudden we lose access to our EHR system during the office visit, and we're trying to bring it back online, and we lose our train of thought and what's going on because we're so focused on getting the connection back. There have been some studies done over the years with regards to what downtime means to a healthcare organization, and some of these studies have shown that the cost can be as high as $488 per hour per provider, so it can be quite expensive. So what are our options with when we lose EHR, when we lose access to our EHR system? Well, we could temporarily close the practice and location until the system comes back up. We could go to paper charts, but because we've become so dependent on EHR systems over the years and haven't updated our paper charts, it becomes pretty difficult for us to do that nowadays. We can implement fully redundant technologies, meaning that we could implement additional servers. We could implement additional network connection. We could bring up another data center. We could add another power system or another cooling system. And when we get into adding these other hardware components and network connectivity components, our costs also increase with that as well. We can even go to hosting situations, but when we go to hosting, we also run the risk of losing access to that through the internet. So that has its risks as well. This is a slide that just kind of reminds us of what examples of failures and downtime situations can be caused by. I won't go into each one of them, but I will focus your attention on a couple of them. The second bullet that says sprinkler line failed, we don't have sprinkler lines in computer rooms, but in this particular case what happened was the sprinkler line outside of the computer room failed and water started to seep into the server room. So the organization had to shut down the server room, and when they shut down the server room, the satellite locations lost access to the host site, and they lost connection. In the middle of the screen, in July of 2015, so 18 months ago or so, you may remember this, United Airlines, the New York Stock Exchange, the Wall Street Journal, the Brookings Institute all had failures on the same day. United had lost network connectivity that was caused by a router, and because of that, they had to ground hundreds of flights across the world for a couple hours. The New York Stock Exchange had a faulty software upgrade that caused them to stop trading on the exchange for nearly 4 hours. The Wall Street Journal had a situation where they had all of this access coming into their website, and they didn't have enough capacity to fulfill the demand, and that caused a failover and caused their system to come down. And then Brookings Institute was offline for about an hour that day due to a content publishing error. If you really think about these 4 instances, and particularly United Airlines, New York Stock Exchange, and the Wall Street Journal, those 3 are built for 24-hour a day, 365-day a year uptime, and they have all sorts of redundancy built into their systems to maintain the uptime and get it as close to 100% as possible. And as shown on this particular day, they had issues with regards to their systems coming down. If you look at the bottom bullet point, you may remember this about 6 months ago. We had a situation where organizations had, when they went to access these sites, had denial of service error come up, and it was determined to be a cyber attack that occurred against DIN, which is one of the largest ISP providers in the world. And when that cyber attack happened, people were not able to access Amazon, Twitter, Pandora, Pinterest, Athena, and many other sites because of this, because all of them are running on the DIN system. So again, the point of this slide is really to, one, remind us of the various challenges that we have with running our systems across the internet, and also what can bring down a system, whether it is a hardware error, whether it's a construction site connection, such as what happened in May of last year. There was some construction going on with some fiber lines out in Pennsylvania and Massachusetts by Level 3, which is a fiber company, and they cut some lines, and Time Water and Cox had lost access to, customers had lost access to their internet as well. So because of human error, because of construction, because of hardware errors, we can lose access at any time, and even large organizations such as United Airlines and New York Stock Exchange can lose access as well. If you take that $488 that I had talked about earlier, and for a 10 provider practice that's down for 4 hours, it could cost the organization as much as $19,520. So it can be quite expensive for a significant downtime situation. So as you think about downtime preparedness, and as you think about business continuity solutions, really the questions that you should be asking and what you should be thinking about are, do I pursue uptime, or do I pursue a solution that enables me to continue on with my business until NextGen comes back online? Am I able to be reactive or proactive in my clinic's preparedness for downtime? Another question to ask are, what other types of impacts that a NextGen downtime incident can have on our clinic or our health center? Another question to think about is, how significant can the impact be to our clinic based on the duration of the downtime incident? Meaning, can I if I'm down for 5 minutes, is that okay? If I'm down for 15 minutes, is that okay? If I'm down for an hour, is that okay? And what do we do, if we're down for that period of time? So how significant can the impact be from what we had talked about earlier with regards to productivity, with regards to patient satisfaction, with regards to lost revenue? How much of an impact can we take in that kind of a situation? How much are we willing to take in that kind of a situation? So, and as we mentioned in the previous slide, the question isn't really whether your clinic will lose connectivity. The question really is how to minimize the loss and how to minimize the disruption when it does happen. So as you're going down this path of downtime preparedness initiative, think about these questions as you're going through it. So the ChartGuard option, and what is it? Well, it is an affordable business continuity solution that ensures that your practice is productive, that it's profitable, and secure during EHR downtime. And you have a complete clinical record that's available to you, the staff, the providers, available offline as PDF files, so that you can continue to see patients and run your business using the output of ChartGuard while the IT group is trying to bring your NextGen environment back online. So with that, I'm going to turn it over to Joe Scholes, and Joe's going to talk about how ChartGuard works.
Thank you, Tom, and thank you everyone for attending today. When ChartGuard was created a little over 5 years ago, we had some goals in mind. And those goals were to improve the patient experience during downtime, to create a solution that doesn't keep all of your eggs in one basket, so to speak. So Tom mentioned all these redundancies that big companies have, and their systems still go down. Now, we still want to do as many redundancies as are cost effective, but we also want to be able to assume that every now and then even those will somehow fall into the category of an outage. So with ChartGuard, what we're doing is we're creating your clinical data in a PDF file that can get stored elsewhere on the network. So we've taken those eggs that are in one basket and we've made copies of them and put them in this other basket. So if we can't get to the first one, that information is still available to you. Now, we've tried to keep the complexity in the chart creation itself and make the using of the charts very simple, because again, when your complex IT systems fail somewhere along the way, then you need something simple so you can get to these charts that get created. So what is ChartGuard and what does it do? ChartGuard is an engine that creates basically the equivalent of a paper chart. It does it in a PDF file. Those files we're always downloading and sending to each other. And the reason we use a PDF file is because it's universally readable. You can pull it up on pretty much any computing device. You can print it out to paper if you need to, or if you want to use it electronically, we can index it to get to different sections of the file to make that more straightforward. So we generate these PDF files, one per patient. So one PDF file chart per patient based on normally who's coming in over the next several days. So the engine runs each night. It goes through the appointment schedule. It looks at who's coming in. It generates a PDF file for each person, and then it moves that PDF file across your network to the remote site. So in the center of the diagram here is your EHR in the center. And this works if you're hosted or not hosted. We have configurations that work with either scenario, but essentially you have your EHR kind of in the center of the universe, either figuratively or literally, and you have your remote sites. So when it runs, it's copied that file out to the remote site, so at 10 a.m. when there's construction down the street and someone cuts through the cables, bringing the network into that remote site, you already have those PDF files on a secure PC at that site. Okay, and this gets back to having your eggs in more than one basket. So now you can't get to the EHR, but you can get to these PDF files, and we'll take a look at those in a little more depth in a couple seconds. The PDF files can be used on paper. You can just have a PC with a directly attached printer, so you can bring up the charts as people come in, print them out to paper, put them in the manila folder just like we did 10 years ago, and go on about your way seeing the patient and having that clinical information available to you. Or if the network's still up within that site, they could access them electronically from their notebooks or tablets, whatever devices the clinicians are using, and be able to look at the PDF file and flip through it. And again, we'll show you that in a few minutes. So a quick recap. ChartGuard each night creates PDF files of the patient chart, one file per patient. It moves them across your network to the remote sites. That way, they're already there when there's an outage later on in the day. And because we're doing several days worth of charts at a time, if the outage happens right before that generation, then you still have the data that we generated from the night before. So it's really been a great way to give you that extra insurance to make sure you have access to the clinical information for your patients who are scheduled to come in. So what's in these PDF files? Well, let's go ahead and go to the next slide. There we go. So out of the box with ChartGuard, you get an appointment listing for each of your sites, and that gets pushed out to each site appropriately so you know who's coming in and what time they're coming in. In the chart itself for each patient, you're going to get a patient data sheet, which is a summary of demographics, insurance information, so you can kind of confirm who they are and that their insurance is current. You get your NextGen module data. You kind of think of the things that are fairly static like medications and allergies and labs. So we pull that information into the chart. Additionally, we pull in documents, both EHR documents such as your chart notes, master IMs, things like that that you're generating your EHR documents from. We also pull in ICS content. So if there's critical ICS content that you need to have during a downtime situation, we can pull that into the chart too. So what you end up with is a real nice PDF that gives you enough history on the patient to be able to have a smooth visit when your EHR is unavailable. All right, Tom, can you go to the next? So now what I want to do is take you through and show you what this appointment report looks like that's going to get sent out to each site, and then look a little deeper at these PDF files. So Tom, if you can bring me to the folder that has these, and then I'll go ahead and drive from there.
Okay.
So what will happen is on the designated PC or storage device at each site, your IT will set up a secure location where these charts will be dropped each night. The system cleans up after itself, so it'll go ahead and purge the old stuff when it copies over the new stuff, so you don't end up with tons and tons of data that eventually fills the hard drive. What we're seeing here is we have our Main Street location, and we have our appointment listing at the root of this. So we can go ahead and go into that. And the information that's on the appointment report can be customized. So if you need something out of a user-defined field or the first, X number of characters from the details field, that can be pulled in here too. But the main point of this is just so you know who's coming in, what time they're coming in. If you're printing the charts to paper, then you can kind of get some idea how many of those you want to print at a time in case the system comes back up. You probably don't want to dump more to paper than you need to. So each site gets their own appointment report. All right, so let's go ahead now and open one of the PDF files. So we go down into the charts. The PDF files are named with the last name, first name, and date of birth of each patient. So they're easy to scroll through and find within the directory. In fact, you can use the search box and be able to get to the exact one that you want. As I mentioned previously, the first page of the chart is kind of this patient demographics, this patient overview that, again, you just confirm it's the right patient that you're talking to, their address, insurance information is on here. Now, what we're seeing on the left-hand side of the screen here are the bookmarks that are available to us in the PDF file, and this allows us to easily move between.
Hey, Joe, I think you stopped sharing your screen.
Yeah, Tom, can you share your screen again? You may have hit the wrong X.
Yep.
So what the bookmarks allow you to do is easily jump between different sections when you're using it electronically. Obviously, when it's paper, you can just kind of thumb through them quickly, but the bookmarks will allow you to get to that module data. So we see the allergies, we see the chronic conditions, the histories that are part of this. So these are all the fields that are available and the data that's pulled in kind of out of the box. And then for your data that you're collecting in your NextGen templates, that's where we pull from the documents. So we work with you as part of the installation to set up what goes into the chart, okay? What information do you want? How much of it do you want? Which documents do you want? Again, how many of those do you want? Any ICS content that you want and need? Which ones do you want to pull into the chart? Now, the trade-off is it's obviously a balancing act between how much patient history you need and how long it takes to generate the charts each night. So one of our analysts will help create a baseline, and then we can kind of tune the chart versus what's essential and what's a nice to have, and we'll put as much as possible that makes sense to you to have in there for a downtime situation. Obviously, if someone saw you, 10 years ago because they had the flu, that may not be relevant today. So we may not want to go back that far in history. It may make sense to only go back several months or, a year or two and pull that history. Okay, so this is really the beauty of ChartGuard. These PDF files are easy to use. They're easy to make available when you're having an outage. They can be open on any device, and they contain all of the critical points that your providers need and your other clinicians need. So when they're seeing the patient, who in the patient's mind, they may have just been there last week, but to the clinician, that was a couple hundred appointments ago, right? So, you know, they don't remember, but the patient's like, well, I was just here last week. Why don't you remember? Well, this way they have all that information available. It keeps the practice running smoothly. It enhances the patient experience and gives you that extra insurance for during a outage situation. Now we're going to go ahead and jump back over to the slides. And one of the things, I'll go ahead and cover this last one and then I'll turn it back over to Tom. But one of the things we can do with ChartGuard is if you do have a specialized need, don't worry. ChartGuard can be customized. Obviously, the preference, just like NextGen and KVM, is to keep things as stock as possible, but we realize that in the NextGen environment, the EHR lends itself to a high degree of customization, and we've really created ChartGuard to be flexible so that we can go ahead and tune that to pull in any information that may be critical to your clinicians during an outage. As I mentioned earlier, the appointment listing can be customized too, so if you need additional information about why the patient's there other than the event itself, that can be pulled into that listing also. All right, Tom, I'll go ahead and give it back to you.
All right, thanks, Joe. So thanks for going through that, Joe. Appreciate it. And then about a couple of years ago, a client had purchased a downtime solution as a ChartGuard, and they purchased it in like July, and then in December they had an outage. And when they had the outage, they had lost access to a couple of the biggest clinics, and they were able to activate ChartGuard and use it at that point in time. And the system administrator there had sent us a quick email saying that ChartGuard worked perfectly for them and that their providers and staff were quite pleased with the ChartGuard output, and it was helped them continue to function without having to close down the two offices. There are a couple of versions of ChartGuard that we have available. ChartGuard in its standard form is a business continuity solution that we just talked about. We also have ChartGuard on demand, which allows you to create a patient chart on request. So if you had somebody come in as a patient and says, I'd like to have my chart for me, you could enter it into the ChartGuard on demand piece of software and then be able to generate a chart for them within 15 minutes or so. It's also very useful for audit requests. If you have insurance companies coming in for audits, if you have attorneys giving you a call saying I need to have patient charts for the past 3 years for these 3 patients, you can do that as well. And then with the ChartGuard Archiver, that is mainly a version of ChartGuard that allows for long-term storage of the patient chart information. So being able to store a complete history of the charts if you wanted to have something like that. So we have 3 different versions of ChartGuard. A little bit about Itentive. We were founded in 2003, as Chelsea mentioned earlier. Our mission is to create additional value for your NextGen investment. We know that when you purchased NextGen, it was a major purchase, and probably that purchase or that investment has grown over the years with upgrades and probably having to add additional hardware. And as Chelsea mentioned earlier, our passion is to work with our clients to help them improve patient care, help them enhance the patient experience, and help them maintain a financially healthy practice. We have 19 years of experience with NextGen, and we have 70-some employees coast to coast or nationwide, that most of which are consultants that travel from health center to health center, practice to practice, working with the individual businesses to improve workflows, improve business process, improve reporting, in order to get the value out of NextGen, out of that investment that you have. If you take the 2003 and the 19 years, they don't add up, and the reason for that is Itentive started out as the IT department for a medical organization, and back in the late 90s and early 2000s, when the focus was to focus on what you do best and outsource the rest, the medical organization was going to outsource the IT group, and the leaders of the IT group said, well, if you're going to do that, what we'd like to do is form our own company and provide services back to you. They agreed to do that, and from that point forward, we've worked with over 350, 400 clients that use NextGen, and we've become a strategic partner with NextGen as well. We have 5 service lines within the organization, and through those 5 service lines, we can provide these types of services as a point solution or in combination as an integrated solution. So we can do implementations of NextGen. I mean, we can mention, as I mentioned, we can do process improvements, workflow improvements. We have a group of developers that can do template enhancements and provide upgrades to NextGen, as well as provide help desk support. We have a group of IT folks that can manage your IT environment, such as your desktops, your laptops, your local area network. We also have our own data center, so we can we host clients as well through a cloud hosting service offering, and then our productivity tools, of which ChartGuard we talked about today. We also have Refund Manager, which streamlines and automates the credit balance handling, refund check processing that occurs within our organization. And our clients that have implemented have told us that it saves them anywhere from 30 to 40 to 50% of the time, so a significant time savings there. We also, for Phreesia, we developed the clinical interface allowing patients who are using Phreesia, or practices that are using Phreesia, their patients can also go in and update the clinical information rather than just the demographic information. And then we worked with a company called DoctorsLink to integrate NextGen with TransWorld in order to lower the cost of collections. So a little bit about our products, other products that we have. So at this time, we'd like to open it up to questions, and as Chelsea mentioned, if you want to go ahead and enter any questions into the question box, we can go ahead and answer questions for you.
Great. Thank you so much, Tom, and thank you, Joe. So again, questions in the questions box. Looks like we only have a couple, so if you have one, feel free to get it in. It shouldn't be too long of a wait to get it answered, and maybe someone else is already asking it. So first question. Does ChartGuard work in large groups who have over 100 providers?
This is Joe. I'll go ahead and field that one. Yes, we have clients both large and small who use ChartGuard. With the multi-provider groups, ChartGuard does have a method for scaling where we can run multiple engines to generate thousands of charts every night and push them across the network to all those sites. But it's good to point out that even if you're a small group with 1 or 2 sites, I mean, an outage is just as critical to you as it is to a large group with 50 or more sites. So either way, ChartGuard is really a great solution to giving you that extra insurance.
Great, thank you, Joe. We have a provider leaving our practice. Can we use this to generate their patients when they leave?
Using either ChartGuard On Demand or ChartGuard Archiver, we have done extractions for providers and practices that are leaving enterprises. So it is a cost-effective way to get the data out of NextGen, put it into the new system wherever they're going as a document without having the expense of doing a discrete item-for-item data conversion. So yes, we can certainly work with you on that type of project.
Great, thanks, Joe. And it looks like at the moment this is our last question. Can we use ChartGuard to give a patient readable copy, or I'm sorry, to give a patient a readable copy of their medical record?
Absolutely. For something like that, you'd use the ChartGuard On Demand, where you can select the patient or even a population of patients and produce those charts within minutes. And of course, the delay is really just the volume of charts that you pick to produce. If you're doing a one-off, that would be several minutes. If you're doing several hundred or several thousand, then you just let that chug in the background for a bit. And typically you do that volume either for legal or audit reasons. But for the patient, that's really a sweet spot for ChartGuard because it is readable information. It's not in XML or HL7 or some format that's not going to make sense for the patient. You can give them the PDF file either printed or on a secure drive or via a secure portal and make that available to them.
Perfect. Well, it looks like that's all the questions we have, but if you think of any after the webinar, you see both Tom and Joe's information up there, and you can feel free to reach out to any of them. And otherwise, thank you so much for joining us today. I hope that you found this useful, and I hope that we can see you at our next educational webinar, which is going to be a week from today. So Tom, Joe, thank you both so much.
Thank you, everyone.
Thank
you, Chelsea.
everyone.
Have a great day.